pregnant women, as we know, undergo some changes in their bodies during pregnancy and changes in the way that they fight off infection. And we think that because of that, pregnant women fall into a somewhat higher risk category when it comes to things like coronavirus. So although most pregnant women who contract coronavirus will do well, there is increased risk of complications like pneumonia, respiratory changes, things like that that could happen to a pregnant woman. Also, the risk of some obstetric complications that could occur to a woman who got coronavirus while she was pregnant, things like preterm labor, early delivery, things like that. Recommendation is the same that I give to all pregnant women all the time, which is to take care of yourself, take care of your families, try to stay safe and healthy. So that's things like hand washing, so good, thorough, 20-second or more hand washing as many times a day as possible. And then things like staying away from people around you who might be sick, staying away from large gatherings. Travel is the most common question that I'm getting right now, and I think it's difficult because we sort of have to individualize our answers to what kind of travel we're talking about. But in general, I think staying away from mass transit, so airplanes, subways, things like that, and limiting non-essential travel is generally speaking a good idea. Local travel by car with a small group of healthy people to a place where there's not a lot of disease transmission is probably more safe. But in general, and I tell women this all the time, trust your gut. And so if it feels like something that's not essential and that can wait, this is a good time. Good evidence that there is no transmission of coronavirus into the breast milk. And we know that breastfeeding in general is very good for women and for their children in terms of passing on immunity and things like that. So breastfeeding in general and as always is encouraged. So I think the best advice is to take good care of yourself with plenty of rest, plenty of water, hydration, exercise, anything you might otherwise do for stress relief. So yoga, walking, all of those sorts of things. And then I think, talking about these feelings of anxiety with people around you and with your family or with your OBGYN as needed is important.